Alexandra Floyd says she did all the right things, masking, distancing, getting double vaccinated, but it wasn't enough against Omicron. Floyd is now at home with her partner, quarantining.
The fact that I got it in the first place was shocking, and then to also then give it to him was, upsetting. I felt really bad to put that on him.
Despite taking every precaution, when she broke the news to contacts, she says it was hard not to feel judged.
Where were you? Who were you with the last couple of days? What did you do? Who are you around? Who did you expose? And I understand those questions need to be asked for sure.
So I have come to terms with the fact that I will have this virus at some point.
This scientist says the evidence is clear. Omicron is able to evade some of our best defenses.
So don't blame yourself if you get it. It's incredibly contagious. And even just like I said, passing by someone breathing the same air is sufficient right now. And nobody can stop that from happening and still have a normal life.
Still, for people testing positive, it means uncomfortable conversations.
You can feel that shame when they call you. And I've been very clear telling them, listen, this is par for the course. This is going to happen to all of us, and you can't feel guilty. This is just what is going to happen at the end of this pandemic.
Experts in pandemic planning expect infections to spread to most of the population as viruses become endemic and hopefully less severe.
And so that message needs to get out there rather than everything we did failed. Because it really isn't about that. It's just the rules of the game have changed, and now we have to flex into a different approach.
That still means critical efforts to limit the spread of the virus to protect the healthcare system and those most vulnerable to a bad outcome. Vic Adopia, CBC News, Toronto.
Let's pick up on some of that hope for less severe outcomes with infectious disease physician Dr. Alex Wong. Today we saw the results, Dr. Wong, of another study from the UK, this one from the country's health security agency, suggesting Omicron could produce fewer hospitalizations and other variants. It does come with some caveats, though. What should we make of this new data?
Thanks, Asha. So the UK data released today would suggest that there's about a 50 to 70% reduction in the risk of hospitalization with Omicron compared to Delta. And that mirrors the data that we've seen thus far from places like Scotland and South Africa. But as you say, there's a lot of caveats and it's still early times. There's only a small number of people in the UK who have been hospitalized. We haven't really had a chance to understand how those people hospitalized have been doing. Omicron's been spreading mostly in younger individuals in the UK, just like with South Africa. And we know those people are at lower risk of having bad outcomes to begin with. So we're going to get a better understanding of what Omicron's going to do with the elderly population as it begins to spread there. Lastly, it's causing a lot of reinfections, and that may also be a reason why there's less severe illness. So a lot of caveats, but honestly, it is reason for some hope.
And, what is the bottom line for people right before Christmas?
There's still a lot of unknowns with Omicron, but we know it's super contagious, probably the most contagious respiratory virus since measles. So just be super careful this holiday season, please. Keep your bubbles tight, keep your indoor gatherings small, 5 to 10 people at most. Try to do the best you can with regards to doing as much as you can outdoors. And as I say, if you have the ability to do so, use your rapid tests as much as you can right before the gathering. Make certain that everybody is optimally vaccinated. And lastly, give props to all those public health people and frontline healthcare workers who are sacrificing their holiday season to help keep us safe and get those vaccines in arms. Happy holidays.
100%. Happy holidays to you too. Thanks, Dr. Wong.
Take care.